So Sunday, time of recording this, and it's time to talk once again to the Minister for Health and Social Care, David Ashford, and our weekly catch-up. And as always, I need to first of all say this will be letters with people's own point of view. Plus, some will be a bit dated because they've come in during the week, and you may say, well, we've already answered that question at one of the other press conferences. But I think it's always worthwhile to read them out, don't you, David? And people catch up.
It most certainly is, Paul. I mean, information changes so quickly when you're in a worldwide pandemic that it's always worth re-emphasising the point, even if it is a repeat answer.
OK, so bear with us. Here we go. Not so many this week. I think, we're on the home stretch. Let's keep our fingers crossed on that one. What's going to be done in terms of resourcing to sustain and expand the current levels of testing, which events here and in Guernsey and all over the world are showing will be necessary to keep on top of the virus in tandem with the rapid vaccination rollout?
So we already have capacity within the testing, Paul. So we do have the ability to do up to 1,000 tests a day. That includes swabbing. Our microbiology capacity in the amount of tests they can process is bigger than this, but so we mustn't forget that testing is a two-stage process. In the event we had a widespread outbreak on the island, then we would do exactly what we did last time, where health services would have to be shut down anyway, because there's certain services we wouldn't be able to run during a pandemic period, and those staff would be redeployed to testing and swabbing. So we are able to actually expand our facility as we need it.
I mean, obviously the big issue is getting contamination here, which obviously slips through, which is obviously where we've been in the past. I've had a couple of people who work for the steam packet on to me, and without reading the full letters, because it's quite long detail, they just get worried that they're not feeling they're getting the full support of management. They've had a couple of positive tests, apparently, according to the letter, and they feel this could be the back way of it getting into the Isle of Man. Any words on this? I know the government owns it, but I'm not asking you in that sense. But it's this thing about they're worried that it could be the back way of getting more cases on the Isle of Man.
Well, the steam packet's an arm's length company. I do need to be clear on that. Although government is the shareholder, it is an arm's length company and operates as a private company. In relation to them, they have very strict protocols that they need to follow in relation to how people board the boat, how staff are dealt with. If people feel that any company is not performing to the protocols in place for them, then they do have the ability to report this to the Health and Safety Executive and also to Public Health, who will actually look at what the points raised. But there is very, very strict protocols with Public Health and with, with the steam packers around how passengers must be dealt with and also how crew must be dealt with as well.
OK, so that's interesting. So it's a public health issue. If anyone feels worried about the 2 metre distancing that has been in place, obviously, until now.
So it's the Health and Safety Executive first, the Health and Safety at Work, the contact details for which are on the COVID-19 website. Okay.
Because obviously the steam packet does have quite a lot of foreign workers involved, doesn't it? And that's probably, I think part of the letter was about the mixing of Manx people and people who live across and how it all works out.
Yeah, so there are very strict, as I say, protocols in place for the steam packet to follow. The Public Health have had to approve and are happy with. But if anyone feels that any protocols are being breached and they don't feel that any company is listening to them, there is the ability for them to report those concerns via the Health and Safety at Work.
We're all looking forward to the opening up of everything from Monday, but I'm still worried about the case of potential contact at the Gaiety Theatre during the pantomime. Should we be going back to cinemas and theatres? And if so, should we wear masks?
Yes, people should be going about their business as normal, assuming nothing, I don't want to curse it now, but nothing happens today, then we will be lifting all restrictions after midnight tonight. So people should go back about their daily lives. People need to do what makes them feel comfortable. I think I said this at the last press conference. It's important. There will be people who will still be concerned. There will be people who will still want to wear masks in public, and that is perfectly fine. People should do what makes them feel comfortable. In relation to the Gaiety Theatre one, as we were aware, nothing came off the back of that. We are lucky in that event, but that was back on Boxing Day now, so there is no risk of transmission chain really from that event. People should be willing to go to the theatre. They should have confidence to go about their business. We wouldn't be releasing the restrictions if we had any doubt about that, but people need to do what is right for them as well.
I don't know about you, but if someone was coughing a lot in a cinema or something, I would be thinking, oh, but that's just, it could be a cold. Obviously, someone could have swallowed badly, anything, of course.
Yeah, I mean, this is the issue, Paul. I mean, people will be nervous, and again, it's perfectly natural to be nervous. People shouldn't be worried about that. But equally, people need to make their own decisions. We're handing people back control of what they do in their day-to-day lives. We're releasing all restrictions, and people need to make the judgment calls that are right for them. If people don't feel comfortable in certain settings, then don't attend those settings.
Once I've been vaccinated, how do I prove it? Will it be necessary to have proof of vaccination for all sorts of reasons? I must admit, that has come up many times. I mean, catching a plane, and we know like Saga Holidays have already said with their cruise lines, they want proof of, I was going to say purchase, but proof of vaccination before anyone can do that sort of holiday again, certainly for the next few years, I'm guessing.
Yeah, so if we focus on Saga, first of all, Saga obviously caters to the older, should we say, aspect of the population. And what they're after the proof for is to show that person is protected, because there's something we've got to remember fundamentally with the vaccine, which is that the vaccine only protects the person who's vaccinated. It doesn't necessarily stop the person contracting COVID-19 or transmitting it to others. It will only protect that person. So at the moment, I don't think there'll be many countries that will go down the route of asking for vaccination proof in order to enter a country, because it's not preventing that person who is vaccinated from passing it on to anyone else. That's something that may change as the science progresses, but at the moment the jury's still out on that. There is a card given to people who shows that they're vaccinated, but if we needed to go down the route in the future of doing vaccination certificates, then that's something we could look at, but no one is demanding that as the moment.
All right, that's similar to the next bit is, once we go for the jab in the Isle of Man, do we get a piece of paper stating we've had it?
Yeah, so there is a vaccination card, as I say,
Yeah.
which happens with all vaccines, just to say that you've actually had it. But that doesn't actually mean a formal certificate.
But you could take it with you or something if you wanted to, could you?
Well, one of the things we've got, where I think, it's a very informal card, so I don't think that would be accepted as proof in a formal setting. But like I say, I do need to caution on that. I don't think at the moment there will be any sort of push by people for vaccination certificates in order to enter countries, because it only provides protection for that person. It doesn't provide that person not catching COVID or transmitting it to others.
So to be clear, let's say that Saga thing, you're going on holiday in a few months' time. Do you go back to your GP to get an official letter from them then? And does that cost money?
Yeah, so it can be produced by the Department for Health and Social Care. We can produce it, and I wouldn't expect us to charge for something like that, because we are just producing something saying that someone has been vaccinated.
It's pretty incredible. We're talking about holidays. Anyway, if someone receives a letter asking them to call 111 for the vaccine, and that person at the time refuses, can they at a later date change their mind and call 111 to agree to have the vaccination?
They most certainly can, Paul. Once someone has been invited for a vaccination appointment, at any point from that point on during the vaccination programme, they can request to be vaccinated.
Residential homes, sheltered homes and housing are returning to normal from Monday. I'm a self-employed hairdresser and only work with the elderly. Some of my clients would like to know whether they're able to get their hair done next week.
And that will be obviously down to the home. If they're going into the home, it's whether that particular home is now allowing visiting. In relation to DHSC homes, we are allowing visitors in, but in relation to the private homes, that would be a matter for them.
This one really has been answered, but I'm going to read it out because they've sent it in. Guernsey was clear, but is in a matter of days now has over 80 infections. In fact, it's gone up a lot more since then, hasn't it?
Yes.
Asking you if you'd recommend the continued use of face masks and of social distancing where appropriate. I think you've already answered that, but yeah.
Yeah, we feel it is safe to remove the restrictions around social distancing. In relation to face coverings, it was only ever a recommendation, a strong recommendation, but it was never legally enforced. So people now have to make their own choices. In relation to Guernsey, we could have gone that way with this outbreak. We've been exceptionally lucky that we haven't. I think there were to 142 active cases as of last night.
Which is more than Jersey, I think, now, isn't it?
And Jersey seems to be ticking along with a couple of cases, and I know they've had maybe a cluster emerge again, but I don't know. But they don't know the full extent off the back of that now. But in relation to Guernsey, it is very unfortunate what they've gone through, and it could well have been us. That's the problem with the virus; you never know where it's going to pop up.